Now, the World Health Organization declared the world that the dreaded COVID-19, it declared to us all over the world now that the dreaded COVID-19 is no longer a public health emergency of international concern. Now, that's the Secretary General of the World Health Organization, Tedros Ghebreyesus, made the declaration on Friday after a review of current evidence that shows that there is high population level immunity from the SARS-CoV-2 infection, improved knowledge of the virus, and management of the confirmed COVID-19 cases, a decline in the global burden of the virus, and also a steady increase in vaccine uptake across the countries. Now, with this cheering news this morning, we'll be talking about this, and we have in the studio Dr. Yaya Disu, the head of Risk Communications and Community Engagement, National Center for Disease Control Prevention, NCDC, and also we have Temilade Onilede, the Program Officer Dubawa, that's from the Center for Journalism and Development. Thank you so much for joining us on Daybreak this morning.
Thank you.
Thank you.
Yeah, quite a cheery news, really. After years of battle, if you like, the WHO is saying that we are, not totally free, but at least it's not a disease or a virus of global concern or a health emergency, if you like. This was the same disease that was predicted some time past at the early stages, that perhaps continents like Africa, Nigeria will be seeing bodies littered on the streets everywhere. Now it's all over. It's a hurry yet, isn't it, Doctor?
Well, thank you very much. It's over, but it's also not over, because the virus now remains with us and within countries. And the reason WHO has declared that was the fear that it can easily spread across country and cause severe damage to lives and properties, just like what we have seen due to lockdown, economic lockdown, loss of lives, especially in the Western world. So the fears was genuine then. But now, with the immunity that's increased across the population, and then with the vaccine uptake that is increasing, and then there is confidence that, we can tame the virus. And that's why they declare it over. But then, these viruses mutate. So a new variant might just emerge. And when that happens, what it means is you don't even know whether it could be a more virulent one. That's why we need to be careful. So it now goes to become part of the routine infectious diseases that we manage, like Lassa fever, yellow fever, malaria, and so on and so forth.
So, Doctor, when I heard that announcement, the first thing that came to my mind is, okay, COVID. Because, a lot of people have, especially in Nigeria, a lot of people have moved on with their lives. Like nothing really happened. But then the announcement came with, a warning. It says that, yes, it's no longer an emergency and all of that, but it's not yet Uhuru. We're not, it's still here. But in Nigeria, we don't act like only 3 years ago there was something this threatening across the world. In Nigeria, in fact, the centers that were set up have all been collapsed. Is that the way to go?
That's not the way to go. The novelty of the virus in the beginning was what was driving the panic among the population because of the havoc it was causing in Asia and then also some parts of Europe. Coming to Africa, when Nigerians now realize that, they were not this vulnerable, as vulnerable as people in the Western world, and they just felt that, they can cope with the virus. Meanwhile, we have also lost some loved ones among us, the vulnerable population. Maybe we were lucky, could it be because of the environment, the weather, because you can also see exacerbation during winter in those countries. And this is a hot environment. So one of the factors that determine the survival of the virus is also the temperature. So that can actually work for us, and maybe that was one of the major reasons why we didn't experience this. There could be some other factors which probably with research they may be able to unveil that the reason why we are not so vulnerable to this. But then it still affected us because it was a global event that affected restriction of movement across globe. So medication, goods could not move, so there's no way we will not be affected by that. So that's actually the reason why we need to be careful. And again, we have vulnerable populations among us. People who are living with HIV, people who have immunosuppression, the elderly ones, right? So it's also possible that if they get this virus, anything can still happen. It doesn't mean that we don't have the virus again. Yes, we are happy that it's no longer public health emergency of international concern, and that's going to affect a lot of policy issues with regards to how you do business transaction, tourism, and then although with vaccination, I think those have been taken care of.
With vaccination? How will you describe the vaccination level in Nigeria?
Global level. No, the vaccination level in Nigeria is still is crawling, but at least people are taking it, and then we are moving on gradually. Okay. But we need to do more.
All right, Temilade, to you now. How would you say that the spread of information has impacted on our response to the whole crisis up in issue, and where are we now with regards information on this issue?
Thank you. So basically, when COVID started, there were a lot of misconceptions about the virus. We had overabundance of information, let me put it that way. So that was why we later heard that, okay, we're in an infodemic period. Apart from the pandemic, we're also in an infodemic period. We had a lot of misinformation about the virus, that it's not real, it wasn't available, the blacks could not have it, and so forth. And it was just so much for we in the media to bear. So as fact checkers, we then have to, of course, put off our thinking caps to say, okay, how do we curb some of these menace of, the misinformation that is spreading? Then we decided to say, okay, so for instance, now the Pointer, that's the International Fact-Checking Organization, decided to say, let all fact checkers, let all media houses come together to curb this misinformation, because there were a lot of info going around about this particular virus, and we needed to do something fast. There were misinformation about the health, about the vaccine, before the vaccine started, that the part of Africans cannot be infected with this virus. There were part of African that were saying that the temperature, just like Dr. Diso has said, it were a lot of misinformation.
I recall even the vaccination itself, people started saying things like, oh, there's a magnet somewhere.
Yeah, exactly.
If you take the vaccine,
you had videos, a lot of videos on the internet showing people putting magnetic stuff, and they were like, okay, if you take the vaccine, you'll be magnetized, and the like.
Some sort of a tracker.
A tracker. Exactly. so it was a lot. It was a lot. But then with the help of the media, with the help of fact checkers, we're able to at least stem some of these conversations, able to at least put the truth out there of what exactly this virus is, and how, of course, how to manage the information being passed across during this period.
Temilade, I know that the fact checkers, the group, they did a lot of work to curb this information, misinformation, and all of that. I agree. And I also know that there were lots of videos about people taking concoctions, and they were saying that it could heal, the COVID. But between then and now, would you say that the way Nigerians perceive COVID is better based on the work that you did?
Well, yes. Initially, a lot of people did not believe that this virus existed. But then when it came to Nigeria, there was still like a myth. But along the line, we started realizing when the lockdown started, a lot of people started hearing, they were, of course, seeing what NCDC was doing, that, okay, this actually is amongst us and it is real. So now, it was so difficult to adjust to that part of our lives. And it was difficult for a lot of Nigerians to adjust to that part. However, we decided that, okay, people know that this is, a percentage of the nation knows that this is real. But then a part of me like, okay, this is not real.
Temilade, would you say that the percentage that you're referring to is the people in urban areas? Because people in rural areas, I do know that there was a huge problem.
Yeah.
would you say that those people in rural areas were able to at some point admit and accept that this was there?
To a large extent, yes. To a large extent,
well, maybe
yes.
Doctor can also help us in this instance. In your analysis at the NCDC, what are some of the perceptions that inhibits even the vaccination, and then the whole perception about the virus?
Based on what Similarity first said, when the outbreak first occurred, because he wasn't with us, the data we were seeing in China, people believed, right? But when it came to Nigeria, initially there was this panic based on prediction that millions of people, deaths on the street, and then so people were living with that fear. But then when people now realized that they were not seeing people who are really affected, because this disease spread in clusters. As if somebody has it now, it's most likely close ones to you, and your friends, families are the ones that are likely to manifest it. So, of course, those who are victims, either directly or indirectly, they believe that this virus is real, especially those who have lost people. But those who have not seen, because that projection that, we will be seeing people dying just like Ebola in Liberia those days. So, because people didn't see that, said, that this could just be a hoax, and as in, they may just some people are just deceiving us, some people want to make money. And there is also this factor, this distrust in government that pre-existed before COVID-19. And that alone too, when the national government was talking, Nigerians are always attributing it to, they want to make money, they want to do this, they want to do that. I
remember that people started saying things like, well, we are not seeing the evidence, we are not seeing the people infected. Exactly. We are only hearing about numbers, but we are not seeing the people who have been infected. By the virus.
People are looking for evidence, and even when they saw people who have evidence, they will tell you that they've been paid, it's not real, this, that, and except those who experience it. Because I also know some celebrities that got this virus and they came on here and started talking that, wow, this is real, this is that. So, and then again, political disagreements also fuel this misperception, because when some government, at certain levels are telling you that this is not real, this is not whatever it is for whatever reasons, and that also contributed to the fact that people believe that, even government themselves, they don't agree that this virus is real. That means there's something that they are hiding. But the reality is, the virus was among us.
How much of a challenge are some of these perceptions to realizing that herd immunity that was needed to be able to curb, the spread of the disease?
Well, with regards to people, they were not even thinking about herd immunity. The first thing is this virus real? It is those who believe that it is real that they can now think of, okay, are we going to be protected against this? Is there something called immunity? But another reality is there's a possibility that we have had underground transmission. That many people, because at some point people will have come down with symptoms. I know that recently, and even when there was mild exacerbation across the globe, and I know of people who are calling from certain states that, people are having some symptoms, and somebody was able to do COVID, say, this was actually COVID. Right. So, but there are so many people around who did not do the test. And my own brother even called me, and he told me that he was having the symptoms, could it be COVID? I said, okay, go to, it's not out in Abuja, go to a facility around you, ask where you can do COVID tests. They said they've shut down all the testing centers, so it could not confirm. So if we don't test, we will not even know that this COVID
is it possible that perhaps some people got infected with COVID at some point in their lives and they never even knew?
Yes, it's possible.
They recovered.
It's possible, because we even have asymptomatic people who have COVID who did not even show symptoms. Some have it, they show mild symptoms. Some have it, they show severe symptoms, they're able to recover. And some had it and they never recovered from it. So it's a spectrum of manifestations Just like we have for many diseases, some people who have malaria, they'll be moving around, and you check them, you see like 3 pluses of malaria parasite in their system. Meanwhile, you check another person, 2 pluses, the person is down. So it also depends on our immunity and the nutritional factors, the lifestyle we live, and will determine how we manifest this disease.
All right, doctor. During the COVID, at the height of the COVID, the NCDC was very popular. They were addressing the people and all of that. And I do know that when Ebola came, I mean, the government, the Ministry of Health, that's how they were sensitizing Nigerians and all of that. Would you say that how prepared is our health sector for emergencies such as this? Because it appears to me as if when there's a problem, they rise to the occasion, and once that goes, everybody relaxes, and then we wait for the next one and the next one. Now we have seen that people have gone back to their lives like nothing ever happened. Is there a sustained effort to see that that we're prepared for this kind of things?
Well, it's unfortunate that we always show knee-jerk reaction to situations, not just even in the health sector. It is only when there is problem somewhere you see everybody talking about it and then taking action. The moment that goes, then business as usual returns. It's the same thing that happens here. I think it's part of our education system, as in maybe in our early childhood, the culture of preparedness, maintenance, right, as in to be able to envision problems that can happen and then solution. And then when that begins to happen, and that is when we're going to value preparedness, as in for unforeseen events. Something like, even we still have Lassa fever, cholera among us. You see cholera still occurs every year. When cholera comes, it kills hundreds of people in a state and then across the country. But after cholera, then everybody goes back to business as usual. And we didn't usually look at what are the drivers of this cholera. Why? We know it's problem of poor sanitation, poor water supply. With that alone, and we should have achieved or attained a milestone in terms of improving our infrastructures. So it's the same thing that we carry over to whether it's COVID or whatever it is. But the moment we see the reality in our lives, and we all start responding. When the same thing, if you go to worship places, when people have problems, that's when they go to see God. They go to see their pastors. The moment the problem is resolved, and then they forget that until another problem comes. So I think it has to be our values and our culture and an education system, not necessarily through school alone, but the media, how you set agenda, how you frame, and then to also do advocacy to authorities who put up policies in place to ensure that these values are sustained. And just like I was saying, that when we have that culture, and I think it will spill over to every other thing that we're doing. Okay.
Temilade, the World Health Organization is basing its decision to declare this COVID no longer a public health emergency of international concern, based on the fact that there's increased awareness among people of COVID-19 and how it spreads. But can we say the same for Nigeria, and how informed do you think that Nigerians are about the various, what do you call them now?
The protocol.
The COVID-19, there are various, it has mutated into
variants.
Variants, yes. How informed are Nigerians about the variants of this COVID, and whether or not they can actually recognize when they are down with any?
I would say that majority of Nigerians are a bit informed. But for internet users, people who have access to internet that are seeing what is happening worldwide, they are really informed. So of course they know that, okay, this is literally no more a health crisis, a general health crisis, and they know how to, of course, grab their information right now. However, the people in the community level, we can't say the same for them, because of course they don't have access to internet, they don't have access to mobile phones, they don't have access to most of the technologies that we have access to, and they might not even have the knowledge that we have at the moment. So I think we should still need to do a bit of community what's the word now? Community enlightenment for them. So at least know that, okay, we know that this COVID is no more with us. However, there are still some measures we still need to put in place to ensure that we don't have a spike in COVID anymore.
Temilade, would you say that even the process of the enlightenment in the past, would you say that it was a bit faulty? Because, for instance, I think that a lot of Nigerians think that they were told to wash their hands once they go out and come back, not to get COVID. They were not told that it's a way to stay healthy. It's a way to keep your hands clean and so that germs will not remain on your hands. Because what we see, like in some worship places where they stopped the exchange of shaking of hands, they have gone back to that, you know. And the reason all of those things were taken during the COVID, it wasn't just to keep COVID at bay. It was because it meant that if you were healthy, if you were clean, there was a chance. But it appears as if a lot of Nigerians felt that, okay, that was a way not to get COVID. So it wasn't beyond that. And it appears to me as if that is why those things are not being sustained going forward.
So I think it's a personal hygienic issue right now.
Yes, but was it ingrained in people that, okay, if you're clean, if you keep your hands clean, it's, you know, your
like
health.
This is a habit you should carry on with.
This is a habit that should be a lifetime thing, a part of you, like, you know.
You know, for a level of people that are literate, they know that, okay, this should be a lifestyle. But, you know, for people in these low-income areas where you know that they don't really have access to water, clean water, they don't even know what hygiene means, really. Do they know they have to wash their hands? They can just go to the farm, you know, till the ground, and of course use that same hand to eat. They don't know what some of this hygiene means. But then, even we that are still literate, we still find it difficult to keep some of this thing. But I think media literacy will still work. We still need to keep doing most of this. We need to enlighten them that it's not because of COVID you should wash your hands. It's not because of COVID you should you know, cover your nose while you sneeze. It's not because of COVID you should use sanitizers. It should be a lifestyle. It should be something you do on a daily basis, even to keep yourself away from germs and the like. So we still need to do a bit of this enlightenment to both the people in the community level, low income areas, and even we that we claim that we are also literate.
Okay. Doctor, talk to us more about these variants of COVID-19 and where we are now, because I've lost count. It's from one variant to another. You hear this one, and then whether or not the symptoms varies for these different variants.
Okay. Before that, I just want to add to this last conversation. The hand hygiene that you're talking about, that the Nigerians were not told that it should be an habit. But I told you that it has to be culture, right? If from childhood you know that you need to wash your hands to maintain your health, right? As in for your own benefit, and it has been part of you, it will be easier for us to layer on that when there is an outbreak. But because that is missing, so they see it as an action. And usually during emergencies like this, we tell people what to do. That's an action. And you move from action to practice, then to culture. So your behavior change does not take place in a day. The moment they hear that the cases have dropped, then they go back to. But if it is a culture, that's something you are used to. You yourself, you know that when you fail to wash your hand or you miss a step or whatever, you start querying yourself and like, oh, you start imagining what could happen. Now, with the variants, we started with the COVID at that time. They couldn't describe any. They just said SARS-CoV-2. Then later we had an Alpha variant that was in the UK, and the one that really caused havoc in UK. Then later we have Delta variant. But what we now have is Omicron, and there are sub-lineages of Omicron that we are having, and it's highly transmissible, although more mild or milder than other variants that have existed in the past. So,
after Omicron, I thought there's one Arcturus.
Oh yes, they said that was the one that they said. There's even this one they talk about in India recently that was affecting children or whatever. But we have not identified that in our environment. So I'm just talking about what we have seen in Nigeria, and then it's still the Omicron lineage, and we still do tests, as in those who know that they are vulnerable and that visit clinicians, and the clinicians suspect that could this be COVID. If somebody has HIV or whatever, they test them, and then if they pick it, and we still do genomic sequencing, and for us to be able to track what variants that are emerging in Nigeria. Although with the declaration of public health emergency over now, it's going to also affect the attitude of the people. They will tell you that they say there is no COVID again, and then they just feel, why should you ask me to test? So that's why we need to intensify this campaign. And I actually appreciate this. When I was called to come and appear here this morning, I am supposed to be on leave, and I said, look, this is the time we need to also start letting Nigerians know that COVID is not yet over. It's just like Lassa fever, malaria that can just come and kill people, and it may now be a seasonal disease. Sometimes we may mix it up with some other diseases, and before you know it, we've lost lives. And we don't want that to happen. If people have it in their consciousness, they go to for test. Even you can also ask your doctor, can you please do this test for me?
Dr. Disu, the WHO also mentioned the issue of long COVID, which it says, stays for months and for years. And it called on countries to come up with immediate and sustained efforts to deal with that particular one. What is Nigeria doing about that?
Well, long COVID has to do is a clinical situation. It is those who are really affected, who have been infected with COVID, who have long-time manifestation of this disease. Maybe because of the fewer number of cases that we have, right? Well, unless we see clinicians who have been able to follow up people who have COVID. Our hospital health-seeking behavior in this part of the country is poor. It is when we are at the point of death or when the severity is very high that's when we visit a facility. The moment we are fine, we won't even go back for checkup again. So I'm sure even there are clinicians, maybe centers where they want to monitor this, and I'm not sure, unless with this information you have asked now, I'll also try and see after this to find out from those clinicians who have followed up, who have managed COVID cases, how many of them are able to come back for them to follow them up, to really understand how it has emerged or evolved in them.
Okay.
So,
but
yes.
with regards to the symptoms,
Yes.
the other leg of the question I was asking, whether or not the symptoms varies based on the variant.
Yes. Basically, they are all respiratory illnesses, and they usually come with cough. But initially, the first SARS-CoV strain that we had, that cough, breathlessness, and then difficulty in breathing, and then general symptoms. You feel fever, malaria, just like when you think you have malaria, headache. Because I also got COVID myself, so I felt it.
Oh, so you survived?
Yeah, yes. That was 2021 December. So, and initially I thought it was malaria, but it was later a colleague of mine who said he has tested himself, and in the office he said, oh, he had COVID. He has confirmed that it was COVID. I was like, oh, could it be COVID I'm having? Because I've done all what I needed to do to protect myself. That was when I rushed down to Ghana to take my sample, and lo and behold, it was COVID. And so I now knew that, oh, so this is COVID. So the thing is general symptoms, and all of them come with it. But there was a variant that came with mild cough. It doesn't even show cough at all. I can't remember whether is it Delta or so. But the problem with that is it penetrates your lungs more, as in it's difficult to even diagnose it because to get the sample, you may not find it in the usual place until maybe the level of the virus in the system is so high that then you can put it on the nasal, whatever it is. That was Delta at that time, because I knew that.
Which of the variants is dominant in Nigeria?
Right now, is the Omicron that we have, the sublineages of the Omicron. That's what we have now. And that's what you have across the globe too.
Okay.
What policies do you think government can come up with to ensure preparedness? I'm going back to preparedness so that another one doesn't come and then we're running helter-skelter, we're wiping all the shelves in the pharmacy of the sanitizers there, and like what happened with the COVID.
Okay.
How can Nigeria be a bit more prepared?
Okay. Actually, from the NCDC perspective, we focus more on preparedness now, and leveraging on the lessons from COVID, resources from COVID, laboratories that we have built across the country, expertise that have been acquired due to response to COVID, and also the networks, partnerships, and then to now see how to ensure that we translate to preventing and then responding early to other diseases that we have, meningitis, Lassa fever, cholera, and then COVID is also still around. But when it comes to preparedness, investment in preparedness is very cost effective, and it saves us resources that we should have used for other things like education or development. We will be using it for response. But when we are investing in preparedness, people feel you're wasting money because they have not seen the
need.
Yes, they've not seen the need. Right. That's the general problem we have in public health. But we need to continue to let people know that.
Okay, Temilade, in 1 minute to conclude your thoughts, what should be our approach, going forward? Yes, it has been declared no longer a public health emergency, but in terms of dealing with, Nigerians, how do we move forward with communications?
First and foremost, I think we should still not drop down on our hygiene level. We should, continue to be hygienic. We should still do the needful in terms of how to keep ourselves free from some of these viruses, because it now lives amongst us. We don't know who have it or who does not. So we should, based on hygiene, be careful and do better that way. And also in terms of information, we should at least know how to take in some of the information that will be going around. Even we know that it's no more available amongst us, but then a lot of people still, in one way, might still spread one or two. But then we need to know how to take in some of this communication or information that will be going around. And also, based on what Dr. Diso has said, we need to ensure that our health systems are in place. We need to ensure that there's a reform in some of our sectors, the aviation sector, the immigration, the customs. We need to reform some of these borders to know that, okay, for future sake, when this kind of virus or this kind of health crisis comes in, we know how to manage the situation, that we don't bring it in by ourselves due to our lack of preparedness even in the country.
All right. Well, thank you so much for your perspectives. Dr. Yaya Disu, Head of Risk Communication and Community Engagement of the National Center for Disease Control Prevention, NCDC, and also Temilade Onilede, the Program Officer, DUBA. That's a project of the Center for Journalism and Development. Thank you again. We look forward to having you.
Thank you very much.
Thank you.